Hey everybody, my name is Jennifer Colson and I will be presenting on person-centered theory. Carl Rogers is the father of it. Some important terms and definitions. The formative tendency is where us as organisms maintain and enhance ourselves. The actualization tendency suggests an intrinsic source of growth and healing that can be counted on. Genuineness and congruence describes the ability to be authentic in a helping relationship. Unconditional positive regard is an acceptance of and caring for of group members. Empathic understanding is understanding members' internal and subjective frame of reference. Accurate empathy is central to person-centered. It is a way facilitators hear the meanings expressed by the members of the group and often lie at the edge of their awareness. Expressive art therapy is a multi-module approach integrating mind, body, emotions, and inner spiritual resources through various art forms. Some key concepts of how person-centered theory works. Trust in the group process. Trust that humans can realize their full potential. Also, based on a deep sense of trust in the group's ability to develop its potential by moving in a constructive direction. The therapeutic conditions for growth. The climate for growth include individuals having the right attitude to grow, the therapist or facilitator being genuine, having empathy and unconditional positive regard, and a group that is working together, so a cohesive group. Genuineness. The greater the extent to which the facilitator gets involved in the group, the higher the chance that members will grow and change as well. Unconditional positive regard and acceptance. Valuing and accepting members' experiences reduces the defensiveness and clients are more willing to be more open. Empathy, when a member's feelings and personal meaning of experience are accurately sensed. The role of the group leader. So, how the leader applies person-centered theory in practice. The personal qualities of the group leader are more important than the techniques of leading. It is a way of being and not necessarily a way of doing. Group leaders use themselves as instruments of change in the group process. The leader becomes more of a member of the group than the expert. The leader listens carefully, contributes to the climate, is empathetic, operates in terms of their own experience and feelings, and gives feedback only when appropriate. So the basic responsibilities and leadership style of a leader in person-centered theory. The primary function of the facilitator is to create an accepting and healing climate in the group. According to Rogers, the therapist's role is to be a companion to the client or clients in their journey towards self-discovery. The interactions between members, group members, and the leader are critical to members being able to express themselves. The leader establishes a therapeutic climate where members feel free to interact authentically and honestly. The leader pays attention to what the members want to talk about and can help lead the conversation in that direction if it may be having a hard time getting there. Multiculturalism and diversity. Person-centered brings together people of diverse cultures more than other theories and helps to develop a mutual understanding. They bring together the people from the different cultures to listen and find common grounds that unite them. Counselors practicing person-centered theory do not make assumptions based on an individual's cultural background and kind of waits for their cultural context to emerge within the session. A multicultural and diverse counselor recognizes the diversity of individuals and embraces the approach to support the dignity, worth, uniqueness of individuals within their cultural, economic, and psychosocial contexts. According to Glosser and Bozart article, the variables most related to the success of counseling can be extrapolated to the area of multicultural counseling, including the variable of client-counselor relationship. Pedersen also stated that multiculturalism is focused on the relationship more than the technique. Some strengths of person-centered theory are its emphasis on genuinely listening to and profoundly understanding clients' world from their internal frame of reference. It encourages members to take responsibility for their investment and what they want to work on. They are the agent of change. There is the importance of the counselor as a person. Some weaknesses of person-centered theory are it provides little structure for group members. A leader is more of a member or a companion than the expert. The success depends on the counselors maintaining trust. Lack of trust can cause a practitioner to fall back on safe and passive reflection responses. This theory is recommended for hospital patients and counseling center clients. Research supports this theory for people with severe problems like substance abuse, depressive disorder, borderline personality disorder, as well as everyday life experiences like anxiety, bereavement. It is recommended against clients who have come to the community mental health clinic or outpatient treatment center and need more structure in their therapeutic needs. Challenging clients. Joe. Joe came to the group from an individual setting that was pretty unsuccessful for about 3 months. So for this theory, a goal of this theory is to get in touch closer with one's essential positive elements that might be hidden or distorted. And Joe is currently feeling unsuccessful and cynical about his journey to treatment. Person-centered theory is where the members work together, all participating in making the changes they want to see or help members see. The group was trying to participate in the session actively, but Joe made it challenging for others to be engaged and have a cohesive group working together. Now, the group dynamic. Joe appears to be a new member of the group, whereas the other members appear to have been already working together and have already started to develop that therapeutic relationship. So Joe is feeling more like an outsider, which can cause him a difficult time to interact in the best manner. He also appears to be monopolizing the talk time, cutting people off, talking over them, and not necessarily being respectful in his body language and verbal language. The technique from this theory that would be most helpful is really taking the time as the counselor to develop and form a genuine relationship with him. And once that is formed, could help the genuine relationship with him and the other members improve as well. A technique from person-centered theory that I thought would be helpful in a process group would be person-centered expressive art in group. It is In addition to talking about one's feelings, one can create a piece of art. It is a therapeutic process of growth and healing that uses the deep emotions that one might be going through to allow the client to go through a path of self-discovery of their emotions while creating an art piece. I like this because for those that struggle to just talk about their emotions, they're able to do like hands-on. So maybe the awkwardness of talking to a stranger or someone is not the best for them. So doing art could get their mind off what they're actually doing. So I love this technique and would love to use it. Here are my references. Thank you for watching my presentation. I appreciate all the feedback.